Welcome. Today, we'll dive into the fascinating pharmacology of mecamylamine, a drug with a unique history and modern applications in medicine and research. Mecamylamine is a ganglionic blocker and acts as a non-competitive antagonist of nicotinic acetylcholine receptors. This disrupts autonomic nervous system signaling, reducing blood pressure and nicotine reinforcement. Its broad effects, however, lead to significant side effects. Mecamylamine was discovered and first synthesized by scientists at Schering Corporation in the 1950s. It was first introduced as an antihypertensive, then it was repurposed for neuropsychiatric conditions and smoking cessation, but is discontinued currently. Now, I will discuss the chemistry of mecamylamine. IUPAC name, N2,3,3-tetramethyl-norbornine-2-ilamine, is the chemical name of mecamylamine. Molecular formula. The molecular formula of mecamylamine is C11H21N. Now we will discuss the chemical reaction for the preparation of mecamylamine. It is formed by Ritter's reaction of 2,3,3-trimethylnorbornine-2 with hydrogen cyanide in the presence of concentrated sulfuric acid to form 2,3-trimethylnorbornan-2-isoformylamine, which reduces to the final product N2,3,3-tetramethyl-norbornan-2-ilamine, mecamylamine. Here you can see the reaction, and the final product is mecamylamine with 4 methyl groups and 1 secondary amine functional groups. Now, we will discuss the pharmacokinetics of mecamylamine. Mecamylamine is primarily administered orally in the form of tablets due to its high lipid solubility. This route allows for effective absorption through the gastrointestinal tract. After swallowing the drug, once absorbed, it easily penetrates the blood-brain barrier, enabling it to act on both peripheral and central nicotinic acetylcholine receptors. This widespread absorption contributes to its systemic effects. After absorption of the drug, mecamylamine is well distributed in the body and easily crosses the blood-brain barrier due to its lipid solubility. This allows it to exert effects on both the central and peripheral nervous systems. After distribution, mecamylamine is minimally metabolized in the liver, allowing it to maintain its pharmacological activity. Its widespread distribution and blood-brain barrier penetration contribute to its systemic and central effects. When the drug performs its action, the major portion moves toward the kidneys for renal excretion, while a small portion moves to the liver for biliary elimination. Now we will look into the pharmacodynamics of the drug. At first, by inhibition of acetylcholine signaling, it binds to NACHRs on postganglionic neurons, preventing the activation of these receptors by acetylcholine. Then effects on sympathetic nervous system blocks sympathetic ganglia, resulting in 1. Vasodilation, 2. Decreased cardiac output, 3. Lower blood pressure. After that, effects on parasympathetic nervous system blocks parasympathetic ganglia, resulting in reduced gastrointestinal motility and decreased bladder activity. Last but not the least, it has some central nervous system effects. It crosses the blood-brain barrier, resulting in mood regulation, cognition, and addiction pathways, a role in treating nicotine addiction and Tourette syndrome. Now we will discuss the pharmacological effects of mecamylamine on our body. Mecamylamine reduces bronchial secretions by blocking parasympathetic ganglia, inhibiting cholinergic stimulation of mucus production. This can lead to drier airways. It may cause urinary retention by reducing parasympathetic control of bladder contraction. This also causes mood and cognitive changes by disrupting central cholinergic signaling. Mecamylamine causes mydriasis and blurred vision by blocking parasympathetic control of the eye muscles. It also decreases G8 motility and causes dry mouth by blocking parasympathetic ganglia, reducing cholinergic activity responsible for smooth muscle contraction and salivary secretion. It may cause hypotension, orthostatic hypotension, and bradycardia or tachycardia by disrupting autonomic regulation of cardiovascular function. Mecamylamine reduces stress hormones by inhibiting sympathetic ganglionic activity, lowering catecholamine release. On the other hand, mecamylamine has some unusual effects. The first one is nicotine replacement therapy. Mecamylamine blocks nicotinic acetylcholine receptors, reducing dopamine production and preventing the pleasurable effects of nicotine, aiding in smoking cessation. The second one is Tourette syndrome, TS. Research shows mecamylamine can reduce motor and vocal tics, as well as improve mood and behavior in Tourette syndrome, TS, with doses of 2.5 to 6.25 milligrams daily proving effective. The last one is diabetic macular edema. Topical mecamylamine may reduce vascular permeability in macular edema and diabetic macular edema by inhibiting nicotinic acetylcholine receptors on vascular endothelial cells, which are involved in angiogenesis. Now, we will discuss the methylamine toxicity. Its toxicity arises primarily from its mechanism of action as a non-selective nicotinic acetylcholine receptor antagonist, and its antidote has not been discovered. At last, I will tell you the current status of this drug. Mecamylamine is not currently used due to the availability of more effective antihypertensive options, such as Norvasc. That's it for today. Thanks for watching, and take care.